COVID and China? Was it, in your view, 6 years on, a lab leak?
The WHO's position is all hypotheses on the table. I asked China to give us all the information in order to determine the origin of the virus.
That means you haven't had the full transparency from China.
Exactly.
Dr. Tedros, the man leading the World Health Organization and facing down criticism from the US.
I cannot say WHO is perfect, but what I know is we have tried our best.
Give me a message for President Trump.
I think he can make a difference. It's not about the money when I asked the US to come back. It's about cooperation, it's about solidarity.
From Bloomberg Weekend, this is the Mishal Husain Show. When President Trump returned to the White House in January 2025, one of his first executive orders was to withdraw from the World Health Organization.
Ooh, that's a big one. We were paying $500 million. It seemed a little unfair to me. So that wasn't the reason, but I dropped out.
A decision that took a year to come into effect just a few weeks ago. The WHO's work spans the globe, identifying health threats wherever they emerge, and headquartered in this building here in Geneva. The United States had been a founding and crucial member of the organization, its largest donor country. But relations soured when the COVID pandemic set in President Trump's first term. So what happens next? How effective can the WHO be with America on the outside? That's part of this conversation with the man who has led it for nearly a decade, Dr. Tedros Adhanom Ghebreyesus. He has seen a lot in that time. But what you're about to hear is not all about policy or politics. It's his story too, one of adversity and resilience.
Dr. Tedros, you've done this job now for nearly 10 years. I'm interested to learn about your motivation and your background. Tell me about your experience growing up in Ethiopia and what your family went through at that time.
I remember from childhood the images of the war, the smell, the sound. Growing up in a developing country like Ethiopia is difficult, especially where conflicts are frequent, not just conflicts, but major wars. With that background, I can call myself a child of war and seeing people being killed.
You saw this as a child?
Exactly.
With your own eyes?
Exactly.
In the streets?
In the streets, the bad image of war. So that's why when I see the world now rife with conflicts and war, it makes me sad because I can see from my own experience how children actually feel and what they're going through.
What did your parents do to try and protect you from that?
My mother used to warn us not to leave the house and asks me and my siblings to go under the bed, which is with pile of mattresses. This is mother's instinct. She thinks that it would protect us. But of course, it might protect us with light bullets, but imagine if it's a mortar or cannon. It could destroy the house and destroy us too. But at least she would do everything to do whatever is at her disposal to protect us.
Yeah, to give the children a chance.
Yeah, exactly. I remember as a child, actually, me and my siblings wanting to watch what's going on because during exchange of fires, you couldn't see the bullets, especially with lights running from one direction to the other. Child sometimes enjoying what we see, also disturbed by the sound at the same time, but of course not knowing full well that it was also dangerous. But for the mother who's screaming and trying to help, it's a different story.
So your mother gathered you essentially under a single bed, you and your siblings with her. And is that how you spent nights sometimes, the whole night?
Very, very often, yeah, very often. But I remember most of all also when she was crying and praying and crying and praying. And praying just for us to survive. So who would have thought someone whose mother has prayed just for one day survival and then end up being the director general of a global institution?
Yeah. Well, in one way, it makes me understand perfectly how you have ended up doing a job like this. On the other hand, when you've suffered that kind of trauma, you are in a job where you must have to relive it. When you are on assignment, you've been to many crisis-hit places. You've seen Sudan. You were in Yemen, and there was an Israeli airstrike on Houthi rebels at the airport while you were there. How do you therefore cope with what you see and what you experience now as part of your job?
Yeah. In many places, our colleagues are in the middle of a conflict area. I always associate with the people, especially with the kids, how they would really suffer. Sudan, when we traveled to Adri and met with people who fled from Darfur area, mothers and children mainly, you could read from their eyes what they have been through. So I can associate easily with them. And then, of course, you mentioned the Yemen one. When we were attacked by Israeli drones and it hit the airport, we were ready to depart after a mission. And maybe you saw the footage even in the room where we were. The sound was so heavy. But during that time, I wasn't actually focused on that current explosive, which was so deafening. It took me back to the old sound and the old image and the smell that I know as a child.
And today your job at the WHO, it is about extreme situations, but it's also about the everyday basics of health and public health, which are patchy around the world and perhaps have always been so. But as you look across the world today, what do you see that worries you the most?
The biggest worry is the rise in conflict, because that's already affecting many people, millions actually. And as we always say, peace is the best medicine. War and disease are old friends.
War and disease.
Yes. You can see, for instance, Gaza. Because of the war, even diseases like polio that has been eliminated long ago came back. Pneumonia. This is because the war destroys the sanitation, hygiene, the infrastructures, and not only that, destroys the health system. So there is already an increase in the disease prevalence, but the service delivery is also weak. So that's, you see in many countries now, and that's what worries me. I was in Munich Security Conference last year, and I have attended Munich Security Conference actually for many years when I was Minister of Health and Foreign Minister. I have never seen a very worrisome Munich Security Conference last year, because many of the foreign ministers or leaders from high-income countries were announcing their increase in military expenditure. And significant ones, actually, from 2% to 5%, from 1% to 3%. And I asked, actually, some of the foreign ministers a question, why? They said, oh, we feel threatened, you see what's changing. Then I told them, at least don't forget the invisible enemy, which is the virus like COVID that can hit and kill even more than any war that killed in recent memory. It did. COVID killed more than 20 million. So I reminded them of that. Of course, that's what worries me now, with the whole world arming itself and the rise in conflict increasing, including the rhetoric. And sometimes I feel like, are we sleepwalking into a major war like a nuclear war? Because you never know.
That was the Munich Security Conference when J.D. Vance made his speech lambasting America's allies. But when you were putting this across to foreign ministers, I assume European foreign ministers who were increasing defense spending because of Ukraine and Russia, did you feel the penny dropped with anyone? Or have they put COVID 6 years on completely into the past? They can't imagine a health threat like that again.
I think we have this, what they call panic and neglect. So during COVID, I think the whole world panicked and was investing billions. But then when priorities change, then you neglect health and then invest into, as I said, defense. But that should not be the case. There should be a balance. We should strike a balance. Of course, the best medicine is peace, as I said. Some people say arming yourselves could be a deterrent, fine, if that's what they believe. But still, it should not be at the expense of health, which is the number one, actually, in terms of importance. It's only healthy people, healthy society that can progress. So health security should be taken seriously, whatever the situation. Otherwise, we could be in a situation like we have been during COVID.
How far away do you think the next pandemic is?
We're still vulnerable. And people ask me what I think, whether we're prepared or not. I say yes and no. There are many initiatives we have started based on COVID lessons. That's why I say yes, because the pandemic agreement was agreed, the IHR was amended, the International Health Regulation. The pandemic fund is helping already 70 countries, by the way, which we installed in partnership with the World Bank. The pandemic intelligence in Berlin is working well and improving our surveillance system, one of the weaknesses we have seen during COVID. So I believe that we're getting better. And then there is the biohub to share pathogen samples as quickly as possible. So that gives me confidence. But at the same time, these are only starting. We need to continue to invest and make sure that the pandemic agreement is ratified, implemented, and then we can be better and prevent the next one, or detect early and manage it without serious damage like COVID.
But these actions you're taking, everything that you're describing is at a time when the United States is withdrawing from the WHO, which it helped found. We knew that from one of President Trump's first executive orders a little over a year ago, and then in January 2026, you received the formal notification. And COVID is at the heart of that, isn't it? The accusation from the Trump administration is that the WHO mishandled the pandemic, and that's why they're leaving. What is your response to that?
Of course, like any organization or any country, we might have our own problems or weaknesses. I cannot say WHO is perfect, but what I know is we have tried our best and we have done our best. One of the stories that really warms my heart is as soon as the Wuhan municipality posted this new virus in their website, this was December 31st, we took that and started probing or asking questions to China.
This was December 2019.
December 31, 2019. And colleagues at the country level, colleagues at the regional level, and headquarters, including myself, were notified same day. And nobody said this is the New Year Eve. Everybody took it seriously. And even during the New Year, we were working. By January 2nd and 3rd, we got the confirmation from China. And by January 4, we already announced, and of course, the rest of history. No excuse of a New Year Eve or no excuse of a New Year. And then not only that, fast forward, we called for emergency committee by January 20th.
And some of your press conferences and the notable moments of that dark period were in this very room that we're speaking in.
In this very room.
At your headquarters in Geneva. But 5 years later, when you marked the 5-year anniversary, you did ask the Chinese government for data about the origins of the virus. Did you get those answers, the complete answers about where the virus came from?
So taking you back to the accusation of WHO hasn't managed well.
From the US.
Exactly. So as I said, we tried our best. And second, the most important is we learned the lessons from that COVID pandemic. You know, what happened at the country level, some of the weaknesses of the countries, and weaknesses of international organizations, WHO and others. And that's why we started all the initiatives, which I told you. So what matters is maybe we had weaknesses, but okay, you try your best with whatever means you have, and then you learn from your lessons and try to fix.
But the fact that America is blaming you, do you think that is cover for government failings? Is that actually the story here?
It's very difficult to say that, but I know for sure that no country was immune, and almost every country had its own problems with regard to response to COVID. But in the same executive order, the executive order by the president says we're close to China.
That the WHO is too close to the Chinese government.
And WHO is influenced by China, which is not true. Actually, the US influences WHO more than any other country.
Well, it was the largest country donor.
Exactly, but in a positive way, because over several decades, WHO has established excellent relationship with the excellent institutions that the US has, with CDC.
That changed so rapidly. I have to ask you about some of what Secretary Robert F. Kennedy Jr. and Secretary Rubio put in their statement in January 2026, that America has been insulted by the WHO, that even on our way out of the organization, the WHO tarnished and trashed everything America has done for it. The WHO refuses to hand over the American flag that hung in front of it. This feels incredibly personal. So what do you think is really going on here?
So what I'm trying to say is, one of the reasons for their departure, we say the WHO is influenced by China, is not true. It's actually more influenced by the US, of course, in a positive way because of the excellent institutions. And that's one of the reasons for their departure. But there are other reasons as well. But on this particular issue with the flag, the withdrawal is actually decided by the member states. So whether it's a flag issue or whether it's their names in our websites or the information we get from them, or the final decision to withdraw from WHO is done by the member states. So we haven't refused. What we said is, this is a member state issue, so member states should decide. But when I see that they were keen to have this footnote on our website saying they're withdrawing, and they wanted also their flag, we said, okay, we will give you.
So the flag's gone?
And then I took the risk and decided to give them, although it's not my power or my mandate, believing that the governance will understand. And I said I will apologize if this is a mistake. But I have actually exercised a power that I don't have and gave them what they're asking without prejudice to the decision of the assembly.
So what, you had the flag taken down and you sent it across?
Yes, we lowered it formally, giving all the protocols you do when lowering a flag. Don't forget that I used to be a foreign minister. And then we sent our team of 2, I think, to hand deliver it to the embassy.
They still owe money though, don't they?
Of course they do. 2024, 2025, and 2026. And I hope they will settle those money they owe us.
I mean, I think the dangerous thing for the organization is that others are already following suit. Argentina has followed suit. Is it your fear that more will think we too can do without the WHO?
Last year, all the member states approved the pandemic agreement. And not only that, they approved also the increase in membership fee, which is a significant one. This is part of the finance reform we started, by the way. It has nothing to do with the US withdrawal. We identified reliance on few traditional donors as a major risk.
Over-reliance, essentially.
Over-reliance, yeah, as a major risk. So the negotiation took some time, actually, and by 2022, member states agreed to increase this their assessed contribution of membership fee significantly. So by 2031, the contribution from the member states will reach 50% or more. And that will help us to prevent shocks like now.
Are you sure they're going to honour those pledges, though? It's a time of aid cuts. The UK has made cuts to international aid. Germany has made cuts to international aid. These were, still are, but big donors.
So we hope that they will. And the other reason why we're convinced that it can happen is this is burden sharing. So it's not, if you see it in terms of each country, it's not a significant amount. But when you put it together, it's significant. So I hope that they will do it. And they understand also why, because they want WHO to be more independent, because we have to operate without fear or favor. And for that to happen, as they call the economy stupid, it's the financing model stupid. So the financing model stupid means we need to have a flexible, sustainable funding in order to ensure our neutrality and impartiality. Then we will not be pushed by one country, by this country or that country, or dictated by one country or this country, but we follow science.
I do want to go back to the COVID and China question, because you didn't answer it when I said, what was the origin of the virus, and did you get the answers you wanted from the Chinese that you put forward on the 5th anniversary of the outbreak? Mm-hmm. Do you think it was infected animals and infection crossing into humans, or was it, in your view, 6 years on, a lab leak?
So the WHO's position is all hypotheses on the table, natural or lab leak, spillover or lab leak, because we don't have enough evidence to believe beyond reasonable doubt any of the hypotheses that we have.
That means you haven't had the full transparency from China.
Exactly. So we have said that many times, starting from when the first report came in 2021, I asked China to be transparent and to give us all the information that they have in order to determine the origin of the virus.
So how disappointed are you that you never got that?
Very disappointed, because this is not just a science issue, it's also a moral issue, it's both.
And trust, an issue of public trust.
It's a trust as well. So when I say science, when we know what happened with COVID, how it started, we can prevent the next one.
The lack of transparency, doesn't it suggest to you that perhaps it was a lab leak? Because if they're not being transparent, then perhaps they've got something to hide.
So that's what we're worried. Why are they not telling us? Why are they not being honest with us? Because after the report was released and we said all hypotheses on the table, including lab leak, we formed a group called SEGO. And that group prepared many questions, especially related to the Wuhan lab. And I transferred those questions to senior officials, including the president. But we haven't received any response. And without knowing, without getting answers to those questions, we will not be able to determine how COVID started. And that's disappointing, because we cannot force anyone, we cannot enforce any of what we are saying, because we only operate based on the willingness of the nations. We don't have mandate. So the only thing we do is we ask and we make our case and we wait for them to cooperate. But the difficult thing is, for instance, there are some countries, including the US, who say we have intelligence information about lab leak, but we haven't received anything. I also wrote to the US asking for this information, including to the president, but I haven't received any intelligence information that can help us. If they want us to finalize, then they can give us the information that they have from intelligence or elsewhere.
And are you still sharing information with the United States? Because you gather from your network of all your member states, and that's part of your database on current health threats. Does that still go to the US, even though clearly from its statements wants nothing to do with the WHO these days?
Yes, we still keep in touch, and they get all the information that we have, especially the important information they need related to health security. Nothing has changed.
Even though they're not paying any more and they owe you money?
They're not paying any more. They say that they're out, but we give them all the information, because WHO's mission is to make the American people safe and the rest of the world also safe.
But that way they get it both ways. They have their cake and they eat it.
The other issue they raise is we pay a lot to WHO, so we don't want to pay. The surprising part is we also want them to pay less. They want to pay less, and we want them to pay less. The whole idea of the finance reform we started as soon as I became Director General is to broaden the donor base. So the major donors, the traditional major donors, reduce their contribution and the burden is shared. So if that's what they want, they could have stayed to help us succeed in the finance reform, so they pay less.
I want to talk about children and the fact that child mortality is rising after years of very impressive declines. That trajectory is essentially changing. And at the same time, we also have trust in vaccination declining in many countries. What is the link between the two, and how serious is that picture?
For the first time this century, we will see an increase in child mortality. And this is a combination of factors. But if you ask me the two, one is ODA decline, overseas development assistance, and also the misinformation and disinformation that's influencing many parents not to vaccinate their kids. So vaccination rates also has dropped.
Yeah. And we have in the United States a vaccine skeptic who is the health secretary.
Mm-hmm.
Have you had this conversation with him, with Robert F. Kennedy Jr., about his views on vaccines?
By the way, with Secretary Kennedy, we collaborate, for instance, on evacuation of kids, especially with cancer from Gaza.
Even now?
Yes, even now.
In the last month since the withdrawal?
Exactly. So the evacuation continues, so we work together because we have to continue to speak to each other.
Tell me how that works. Directly with him? Do you speak?
Directly.
Do you message?
We message, sometimes we call. Mostly message.
So how would you describe that relationship you have with him?
You know, talking to each other is always good, even when we have differences. For instance, I don't agree with his positions on vaccines, but I agree with his position on addressing the root causes of health. For instance, health is not made in hospitals or clinics. It's made in homes, in schools. It's the food we eat, as he says, real food, and the environment we live in, and our own behavior, whether we smoke or drink or abuse sugary drinks and so on. So we agree on something, we disagree on something else. That's actually what matters. You can still work together while disagreeing on some issues and agreeing on other issues.
But would you call his views on vaccines dangerous, where he says, for example, I believe autism comes from vaccines?
It's not true. And I have issued a statement saying that there is no direct association between vaccines and autism. We have differences on that. And to be honest, especially measles, it's dangerous because measles could kill.
And there's a very serious measles outbreak right now in the United States, the worst
exactly.
for decades. You know this also, Dr. Tedros, from your own family life, don't you? You lost a brother when he was very young.
Very young, yes. This is my younger brother, the next one, the second in the family, actually. I'm the first.
He died at a young age, I know. I'm sorry to ask you this. It's just so. It's an example again of your work being personal to who you are.
Can we have 2 minutes?
Yes, of course, of course. So, are you happy to?
Yeah, we can
continue?
go ahead with this. It's okay now. It's transient, huh?
Yeah, well, this is human beings. This is pain. Do you feel able to tell me about your brother and what happened to him?
Yeah. So I had a brother, and his name was Yemane. And from what my mother tells me, actually, he had measles. That's what I think now from the symptoms she told me. So we used to sleep same bed, play together. So I'm the lucky one, and he was not the lucky one. I survived, just pure luck, and he died. That's it.
Do you remember him getting sick?
Yes, I remember him. I remember, and of course, with the technology now, he could have survived. But the sad part is, with the technology we have, with the vaccines that are trusted vaccines we have, what makes me sad is, kids still are dying from measles. And that's wrong. Of course, my brother died. He didn't have access, and no one would expect, actually, for measles vaccines to be delivered in Africa as soon as they were ready. But as I said earlier, the sad part is there are, even in developed countries where you have access to measles vaccines, but needless, kids die because of misinformation. But there is strong evidence that measles vaccines are actually safe. And parents should use those vaccines to protect their kids.
And also there's evidence that if your child does contract measles and survives, there are complications that can happen later in life as well. So the consequences are very serious.
Exactly. That's
years
why.
Into the future.
Exactly.
What do you think is the way to combat misinformation and the wrong kind of leadership on vaccines? One of the people that Robert Kennedy Jr. has put into the key panel advising on vaccination in the US thinks that polio vaccination might not be needed in the country anymore.
I think health service should not be politicized, especially how we handle or how we respond to viruses or bacteria should not be politicized. If there is anything that politicians should do, should support the experts and spread the expert opinion. Because when politicized, or if it's used as a political weapon to attack opponents, then the result is we lose our citizens. Our kids could die, or our citizens could die.
What do you think then about the exodus of expertise from research in the US, from the National Institutes of Health, which has cancelled funding for mRNA vaccines? Does that agenda cause you concern?
On mRNA vaccine, mRNA as a technology itself, of course, we're using it for vaccines now, but for the future, it could help even with fighting cancers. So defunding mRNA research is a wrong decision. I hope they will reconsider. We're in the molecular age, and this technology has a huge potential. So it's a mistake. But I hope US will reconsider, and I hope other countries will also invest in it.
And the broader MAHA agenda, do you think it will make Americans healthy again?
On that, I prefer actually to discuss on specific issues. As I told you earlier, for instance, with the Secretary on Disease Prevention, on non-communicable diseases, his stance or position on that I agree, while on vaccines I disagree. So I think it's important that we agree or disagree on issue by issue, case by case, because I don't think all he does or thinks is wrong. There are other things I support also in lowering the price of medicine in the US. I think that's very important. But there are some things which are correct and some which we disagree.
Do you think the Americans will be back in the next decade?
I think so, because we still work together, meaning they understand the value of the organization in terms of health security. And they need this platform. They also contributed greatly in building it, and I hope they will come back. What makes it a bit personal to me is this decision is really sad, because I led the transformation of the Ethiopian health sector. Ethiopia used to be top 5 in terms of maternal mortality. It's much lower now. And if I single out one country, the significant support we got from the US. Significant. And I'm very grateful for that, for the American generosity, actually.
This is essentially USAID, which no longer exists.
USAID, CDC, and PEPFAR.
The AIDS initiative.
They were helping me to train nurses, midwives, doctors.
So you've worked with some extraordinary Americans over the years.
Exactly.
You remember the individuals.
And not only that, significant investment in Ethiopia, which I cherish forever. Even with this current situation, I believe that I have to be grateful. And I was also close to many of the former presidents, like President Carter. And he used to help me with malaria eradication. Even helped me fill a gap on bed nets I needed to cover 10 million households with 20 million nets. I think he gave me around 4 million.
So do you conclude leadership is just not the same as the America of the past?
If I tell you more, you would be surprised if I tell you that President Carter campaigned for me to take this position. He wrote personal letters to heads of state and government he knew, saying, I worked with Tedros. Tedros is like this and like this, so you vote for him. And President Clinton, with HIV, the incredible support he gave us, and the progress we have made is because of him. And President Bush, we decorated him, by the way, in Ethiopia because of his contribution to PEPFAR.
He set up PEPFAR, the AIDS initiative, yeah.
It gave hope to many countries, including Ethiopia.
So give me a message for President Trump then. What is his opportunity here for global health? If you could persuade him to put his animosity aside, what's the upside for him?
The upside, I think he can make a difference. For instance, I don't know why he doesn't take credit for it. If there was one thing that was historic during the COVID time, was his initiative, the Operation Warp Speed. Vaccines were produced in a record time during COVID. It's because of him, because of the operation. The COVID vaccines were ready, vaccinated billions of people. COVID was stopped. I don't know why he doesn't want to take credit, but he can contribute to global health because he had done it once. So, one, he can make a difference, and WHO is the best platform to do that. 194 countries, you find them in this place. It's not about the money when I asked the US to come back. It's about cooperation, it's about solidarity. And it's also about US leadership, because I have told you, the most influence comes from the US because of its excellent institutions. And they cannot say other countries' influence, it's not true. So they can continue that for the benefit of humanity. They benefit, it's in their best interest, and the rest of the world also benefits. But it's not about the money. I hear now recently they want to establish something which is $2 billion worth. But in terms of membership fee, they only pay for WHO 130 million. So why invest 10 times to create a new one when they can benefit from a small proportion? It has never been about the money. But what is important is solidarity. Because when WHO Constitution was finalized, it was based on universality. We need to have the universality principle at all times to have the maximum cooperation and solidarity, because viruses get advantage when we are divided.
We've come to see you here in Geneva, Dr. Tedros, and this show is part of Bloomberg Weekend, and therefore I would like to ask what your weekends are like, because I find it hard to imagine that they're not full of work, given the job you do. Indeed, you called me at the weekend before this interview, so what is your life like outside this building?
It's a bit of a boring one. So normally I enjoy having time with my grandkids now. But weekends, Saturday, I'm always in the office.
6 days a week in the office?
Exactly. And Sunday, still at home, but a good part of Sunday also I work.
But church?
Church, you know, as they say, the church of God is your heart. So, normally I do that. Maybe you understand.
Dr. Tedros, we'll let you get back to your work. Thank you so much for talking to me.
Thank you.